Good morning, everyone. We're just waiting for everyone to join and the beeps to stop.
We'll give it a minute, shall we? Just to. Just going to give it another minute just to see if anybody's joining us a little bit late, and then we'll begin. That's okay, Jackie?
Okay, I think we'll go for it. It seems to, the beeping seems to have stopped. Okay. Good morning, everybody, and welcome to our webinar on having mental health conversations with your team. This is part of our Thriving at Work series. So Fern and I are HR consultants with Roots HR, and we will be delivering today's session, which is fully funded by our Social Impact Fund. So as a CIC ourselves, part of our social purpose is to develop management knowledge and skills for people managers in the social sector. As you can see, the webinar will be recorded with the exception of the Q&A at the end. So if you do have any questions, could we ask please that you just put them into the chat facility, which you should be able to see on your screens, and we'll do our very best to answer all of those at the end of the webinar. So today, the topics that we're going to cover will be practical strategies to help foster a culture of psychological safety, and we'll talk about what that means. We'll be looking at approaching or how we approach sensitive topics with empathy and professionalism, supporting team members whilst maintaining those professional boundaries, and cultivating an environment where team members can thrive and not just survive. So I'll hand you over to Fern to start the proceedings.
Good morning, everybody, and thank you for joining us today. So when we ask ourselves, why do mental health conversations matter? The data is showing us that actually mental ill health is becoming more and more the reason for people being away from the workplace. The Chartered Institute of Personnel and Development, the CIPD, which is our body as HR professionals, their 2023 Health and Wellbeing at Work report shows that we are at the highest level of sickness absence in 2023 for over a decade. It was averaging 7.8 days per employee each year over that year. And mental ill health was one of the top causes in both short-term and long-term absence from the workplace, with stress being stated as the highest cause for long-term absence. So when we look at how do we begin those conversations, how do we reduce mental health within the workplace, we're looking at creating a culture of openness. And when we talked about psychologically safe environment, the definition by Harvard Business Review is that team psychological safety is a shared belief held by members of a team that it's okay to take risks, to express their ideas and concerns, and to speak up with questions and to admit mistakes, all without fear of negative consequences. And so when we actually look at that, it's about bringing ourselves to the workplace. And so we can actually feel open, we're able to feel that we can be ourselves. And so why is that important? Well, when team members feel comfortable and they feel like they are bringing themselves to the workplace, they're going to be more comfortable discussing their well-being without fear of stigma or repercussions. Okay, so we're going to look at some key principles when we're looking at fostering that culture. Confidentiality is critical, and respecting those boundaries and privacy. Lead with empathy and be by example, and be non-judgmental. You could feel that you could share our experiences or strategies that we use in managing our own health and well-being. Be proactive, not reactive. Create an open environment and provide opportunities for team members to discuss mental well-being. Now, examples of that could be within team meetings. It could be promoting days like Time to Talk Day, and using some of those organisations that are out there that can provide that support. Things like Mind, the Samaritans, all ways in which we can create that environment where it's okay to talk about mental health in the workplace. Use those active listening skills that we all need. Focus on the understanding, but don't feel you have that solution immediately.
So choosing the right setting is also important. Group settings will provide the opportunity to foster open dialogue and reduce the stigma of raising these issues, but sometimes one-to-one settings are there to provide opportunity for individual support and time. Examples of effective group settings could be team meetings, employee support groups or forums, and other mental health activities. You might have lunch and learn activities, that type of thing. And maybe guided workshops which focus on things like resilience, stress reduction, and well-being. You can also include things like anonymous Q&As or well-being surveys. But the important thing to note is those are really good activities. If you are going to go out and do a survey, then the important thing is to make sure that you give employees feedback on the responses that they've given to you. There's nothing worse than filling something in and then getting nothing back in return. So do remember that you need to follow through on that if you're going to use those activities. And as I mentioned, group settings are not always going to be appropriate because you might have sensitive or personal discussions to have with individuals. There might be a lack of psychological safety in that team meeting, so you want to do a one-to-one discussion. And if they're not facilitated effectively, team or group discussions, then they might not be very productive and they might lead to unintentional harm or power imbalance. So one-to-one settings are useful to balance that group and individual support. Preparing for the conversation itself, you want to make sure that there is a private, a calm, quiet, non-judgmental area where you can have that discussion. So if having it physically, it might be a quiet meeting room. It could be a virtual one-to-one call. Make sure there are no interruptions. Ensure adequate time is set aside. So again, it's something that you don't want to rush. You might want to say to the team member how much time you've set aside for the call or for the discussion, but make sure that you don't have to rush things at the end because that's not very helpful. Use empathetic language and open-ended questioning and active listening. So active listening is crucial. to make sure that you don't feel inclined to offer immediate solutions. So you might want to validate the feelings of the person that's talking to you and their experiences, but try to maintain eye contact with them when you're talking to them, not interrupting, making sure that they feel listened to, and so that you can build the trust for further discussions. So, for example, instead of saying things like, "You seem stressed, what's wrong?" a much kinder way to open that discussion would be, "I've noticed you've been quieter than usual. Is there anything I can do to support you?" Encourage that dialogue by asking those open-ended questions that allow the employee to express themselves freely. So you could ask things like, "How have you been feeling lately? Is there anything at work that has been particularly challenging for you? And would you like to talk about any support that you might need?" It's essential to approach these conversations without any bias. So avoid dismissive phrases such as, "Oh, it's just a phase," or "Everyone feels stressed sometimes." These are unlikely to result in the person feeling supported, and therefore they're unlikely to share their feelings in future. It's fine, as we've said, to maybe give examples of things that you've done or things that you've gone through, but remember, the important thing is you're talking about the individual and their feelings. So importantly, be kind, acknowledge their feelings, say things like, "That sounds really difficult and I appreciate you sharing that with me." And then offer support. "Would you like to explore some workplace adjustments, or can we offer you any support options?" So don't judge, don't feel that you need to offer immediate solutions, and certainly don't rush the discussion. You might then want to offer some resources to the person that you're speaking with. So try to be aware of any local activities that are available to you, any local organisations. We all know of the larger ones, such as Mind, that cover the whole of the UK. But think about also some of the local charities and organisations that are there to support. There's quite a lot of them around. So signpost to professional help if it's necessary. So if somebody is really distressed and you think they might need medical intervention, then you might want to be pointing them to their GP. It might be necessary to go through an occupational health review and follow that process. Or you could also consider bringing in Access to Work, which is a organisation that will support individuals at work. The employee has to instigate that process themselves, so they have to. You can support them, but they have to request the referral and so on. Some organisations already have mental health first aiders, so this is very different from a physical first aider. It's somebody that will obviously be concentrating on the mental health of the team, and it's another person or persons that the individual can go to if they feel they want to talk about something with regard to mental health and they're not particularly comfortable talking to their manager about it, because not everyone is. Consider having things like a wellness action plan or health and wellbeing risk assessments, and Fern will talk a little bit about those shortly. And again, we keep saying this, but don't feel like you have to have the answers. You're there as a support mechanism to guide that person into what support they might need. You don't have to be able to answer the query and the issue. And don't prejudge the effectiveness of any of those resources. So obviously, if you don't believe a resource is useful, then you might not be giving the information on that. But any that you're not sure about, then let that person decide, because what might be good for you might not be good for another person. So it's up to them really to judge whether those resources will be effective or not.
Thank you, Tracy. We're now going to look at organisational resources. And often we think, well, where do we start with this? And what I'd be saying, and we have touched upon it before, is ask your employees. We don't have all the answers, and they may come up with some really great suggestions about how, as a workplace, we can improve health and well-being. So ask them, think about whether, if you do an annual staff survey, incorporating health and well-being questions within that survey. Think about your one-to-one templates and making sure that you're asking those questions during those regular conversations with our team members. Ask things like, do they consider health and well-being as a priority to the organisation? And follow that up with, what would you consider, what would they like to consider is thought about at an organisational level? That might be something like a well-being group in larger organisations, or perhaps a well-being day in all sizes of organisations. Another way in which we can really promote how important us as an organisation are taking mental health is looking at signing the Mental Health at Work commitment. And this is a simple framework using up-to-date research. And there are 6 standards within the framework. 1, prioritising mental health in the workplace by developing and delivering a systematic programme of activity. And beginning that might be a wellbeing policy, it might be wellbeing days, it might just be, how do we encourage reducing the stigma in the workplace? Number 2, proactively ensure work design and organisational culture drives positive mental health outcomes. That could be about flexible working. It could be about what other things could we do as a team or as an organisation in prioritising mental health in our workplace. Promote that open culture around mental health. Really foster that psychologically safe environment, so people feel they're able to discuss things, whether that's in a group setting or in the one-to-one meetings. Increase that organisational confidence and capability. And like Tracy just mentioned, those mental health first aider might be one approach that you might want to consider. And then provide mental health tools and support. And we've already talked about the Wellness Action Plan and the Health and Wellbeing Risk Assessment. That is those tools, the access to work, occupational health, all of those tools are available to help us support members of our team who may be struggling at the moment with their mental health. And number 6 is increase the transparency and accountability through internal and external reporting. And that might be looking at data of people when they're absent from work. What are their reasons for being absent from work? It might be looking at other HR processes and what may be behind that. Could that be something that actually is related to somebody's mental health at that time? There's a link below in the slide which gives a link to the Mental Health at Work commitment. And so perhaps that could be something to take from today, just to look at that and see whether that is feasible for your organisation to consider signing up to. Another thing is the Wellness Action Plan. So this is a personalised and practical tool that everybody can use, regardless of whether they have a mental health issue or not. And it really helps identify what helps us be well at work, what may lead us to become unwell, and how do we manage a mental health problem at work should it arise. And similarly to access to work, the Wellness Action Plan is employee-led. Okay, so it's something that the employee would complete, and then they'd meet with you and talk through it. So Mind also has really good resources, both in terms of the employees' Wellness Action Plan, but also a guide for employers when you're wanting to talk through a Wellness Action Plan with a member of the team. Also, sorry, Tracy. That was my cough that did that. And also to consider a health and wellbeing risk assessment. And what I'd be saying is, don't always think about doing that when somebody becomes unwell. Actually look at these wellness action plans and risk assessments as a proactive tool. So actually when people are well, and you might want to consider that during an induction process rather than waiting until somebody is absent from work.
No.
Sorry. And again, it's remembering that sustaining health and well-being isn't just for one person or one element. It's not just for us as individuals. It's not just as us as part of an organization. It's about that building, those building blocks. And so this model is IGLOO, which is the building of an igloo, which is individual, group, leader, organization, and then the outside, the local community. And I think this really does summarize what you need in place to sustain our health and well-being. And we can probably all kind of relate to certain aspects of some things that really do help us. So yes, we have to look at taking actions ourselves to maintain our own health and voice the support that we may need. And that's not just in the workplace, that's outside of the workplace also. Group, what support do we get from colleagues in the workplace or friends outside of the workplace and family? Leader, the role a line manager has and the support we should be able to provide, which we've talked about previously today. And how do we equip them to manage those risks? And again, things like risk assessments and the wellness action plan will support a line manager to know how do we identify what are potential triggers amongst team members. At an organisational level, how do we develop those supportive policies and practices to improve well-being at work? We've provided examples of that recently. And then our outside, our local community, that external support that's available, that from our local organisations. It could be that actually there's some groups that are run within the local geographical area that might be able to access support outside of the workplace. And again, there's a link there to the Affinity Health at Work. And obviously, again, it's just trying to visualize that actually to remain healthy, it isn't just one block of ice. There's the igloo. Excuse me. So when we're looking at building a culture of care, what does that look like? Well, I think we all individually know what that looks like to ourselves, us individually, but actually, what does it look like for our team and for the organisation? And again, I would always say, ask your team, what does a culture of care look like to them? But one of the things is about leading by example, promoting that culture of openness, sharing experiences and strategies we use individually. Part of the things that I always touch upon is the fact that reading a book, going somewhere quiet and reading a book, just taking yourself out of that every day and immersing yourself into something really helps with my mental health. Also, there was some tools that I adopt now following being part of the HOPE programme from long COVID. And that's about sometimes we've got lots of things that we feel quite anxious about that's going around in our brain, which means that we can't actually relax and look after ourselves. And one of the things they talked about was just to close your eyes and imagine some of those things that you're anxious about is a leaf, and you're putting that leaf in the stream and then you watch it float away. So actually you've removed it from that consciousness and you're watching it float away. And sometimes when we have lots of things going on, just taking that time to actually just close your eyes and relax and think about things that we use individually that help with our mental health and well-being. And let's not forget, it's really important that these conversations with our team about mental health is not just a one-off, it's an ongoing discussion around mental well-being. Other options is encouraging wellness activities or well-being challenges, and we'll talk about what that might look like now, I think. Okay, so when we're thinking about well-being activities, obviously we're all working very differently. some of us work fully in an office, some of us are working hybrid, and some of us are fully remote. And it's really important to remember that when we're looking at activities, we make sure they're inclusive for everybody, whatever their working pattern might be. All right. And it doesn't need to be a financial cost. It could be about going for a walk and consider a team steps challenge. I started mine at 10,000. I've now gone to 5,000 because I found that apparently it was said that that was just as beneficial. And most days, because I work remotely, I hit 3.5, which I know I need to do better. So I make up for that at the weekend. But think about a steps challenge as a team, especially when we're working remotely or if we're in an office-based role. Really, that regular movement and stretch during the day. I think we probably all can count times where we've found ourselves sat in front of our screen, and before you know it, you've gone from meeting to email to meeting, and you actually haven't moved for quite a long period of time. So really promote that regular movement and stretch during the course of the working day. And you could consider, a bit like what I've just talked about, mindfulness, holding a mindfulness at work session as part of your team meeting, or signposting your team to free resources regarding mindfulness at work. And what we'll try and do is include some more additional links when we send the slides out from our following today's session. Okay, so thinking when we've talked about all the things we want to do, how do we address some of those challenges? So when we're looking at how do we reduce that stigma around mental health within the workplace or within our teams? And again, it's about promoting that psychologically safe workplace, normalizing mental health topics into regular conversations. That will go to help reduce that stigma that we still have around mental health. We're definitely come a long way in the right direction, but it's still felt that there is that stigma around mental health compared to physical health in the workplace. And how do we make sure we don't blur those boundaries when we're having conversations? And we've mentioned it a number of times about how important actively listening is. Offer resources, but don't feel you're expected to have that immediate solution. We're not medical professionals. We just want to provide that support to our team members. And where do we begin? Because it is a challenge. Where do we begin when we're wanting to really foster this in our workplace or within our teams? Consider those organisational tools and resources that can be implemented and embedded. Those wellness action plans, a wellbeing policy, perhaps a resource pack of those national and local organisations that Tracy mentioned earlier that are there to provide support. Perhaps your EAP, making sure that is drip fed to your team if you have an employee assistance program. I think sometimes we put an email out to say it's available, but how often do we keep having those conversations that is available to our team members? If we're in a workplace and there's posters dotted around, change them up a bit. Often they give you different posters that you can put out, because I think we become a bit word blind when we're going into a space and seeing the same things on the wall. So perhaps change them up, use those resources that you get from that provider. Tracy.
Thank you. Okay, so in order to support our teams, we firstly need to think about supporting ourselves. So remember that it's not selfish for you to consider your own mental health and to support yourself. It's a little bit like when you go through the safety checks on an aeroplane and they tell you to put your mask on before you support anybody else with that. It's a similar thing here. So think about the things that you can do to support your own well-being. Maybe focus on, if you've got an issue, focus on solutions rather than focusing on the problem itself. Check in with colleagues, so make sure that you've got that interactive support as well from colleagues. Help to create a culture of openness and understanding. So again, you're sharing your experiences, you're inviting other people to talk to you about theirs, and maybe ask your own manager for support. So just because you are a manager doesn't mean to say that these things don't apply to you too. You've also got access to the employee assistance programme if there's one available. So again, it's not exclusively to team members. Managers can access those things also. And consider setting yourself a wellbeing activity challenge. So some of the ideas that Fern came up with, you might want to consider that too, to start yourself thinking about your own mental health. So we've whizzed through quite a lot of information here today, but just thinking still about your own well-being, we thought maybe it would be useful for you to think about this after the webinar's coming to an end. Maybe take 5 minutes to reflect on this before you go back to your day-to-day activities and so on, and think about these 3 questions. So what is the one thing that I currently do to support my well-being, my mental well-being? What is one small step I could take to build my own resilience? And maybe who or what inspires me to keep going? So maybe think about those for a few minutes once the webinar's completed before you go back to work. And maybe those could be the building blocks for your own well-being resilience plan. And, just to summarise, what we're looking at here is to promote thriving at work and not just surviving. So think about yourselves as well as your teams. Okay, so that's all of the content that we have to share with you today.